This is one of the most important decisions that you'll need to make if you are considering plastic surgery. And the question you'll need to answer for yourself is, how do you choose a plastic surgeon and the right plastic surgeon for you? Well, unfortunately, there are wide varieties of doctors out there who are practicing and performing plastic surgeries. And some of these doctors are well trained and they're reputable doctors, but unfortunately, there are many doctors out there who are not. There are physicians who are masquerading as actual plastic surgeons when in reality they don't have any plastic surgery training hardly at all. So today we're going to get to the bottom with this video of how you choose the right plastic surgeon for yourself, because this is a big decision if you're considering having plastic surgery. So let's get started. The first thing is, if you're going to have plastic surgery, you've probably heard this before, you want to choose a board-certified plastic surgeon. A board-certified plastic surgeon is certified by the American Board of Plastic Surgery. In order to become certified by the American Board of Plastic Surgery, you need a minimum of 6 years of general and plastic surgery residency training. You need to pass both oral and written boards, and you need to be upheld to the highest ethical standards. In addition, after you are certified as a board-certified plastic surgeon, you need to undergo maintenance of certification or continuing education. So as a board-certified plastic surgeon myself, I can't just pass the tests and be done. Every 10 years, I undergo another exam, as well as throughout the time, I have certain high requirements that I need to uphold of ethical standards, as well as maintenance of certification, continuing medical education. So if you're thinking about plastic surgery, you can't go wrong by choosing a board-certified plastic surgeon. You can go to the American Board of Plastic Surgery website to find a doctor who is board-certified. Well, that's not enough necessarily, though. Okay, there are two major societies in plastic surgery that, as a plastic surgery potential patient, you really want to be aware of. The American Society of Plastic Surgeons is the plastic surgery society, ASPS, that comprises over 90% of board-certified plastic surgeons in the United States. Now, keep in mind that plastic surgeons like myself are fully trained in reconstructive and cosmetic surgery of the face, breast, and body. And so during our training, we undergo training in reconstructive surgery such as cleft lip and palate repair, breast reconstruction after mastectomy, burn surgery, trauma surgery, all that stuff we are trained in. So we're trained in all of it, but we don't necessarily practice all of it. So if you're considering cosmetic plastic surgery, and I'm assuming the vast majority of you watching this video are, then you also want to consider a member of the American Society for Aesthetic Plastic Surgery, or ASAPS. Now, ASAPS members are the cream of the crop of board-certified plastic surgeons who are performing cosmetic surgery as a main part of their specialty. So all of the top-notch cosmetic plastic surgeons typically are members of the Aesthetic Society. And you can find members, if you're thinking about plastic surgery, cosmetic plastic surgery, at surgery.org. If you're thinking about a combination of cosmetic and reconstructive surgery, then plasticsurgery.org is also a great resource for you to find board-certified plastic surgeons in your area. Well, are other credentials okay? Well, there are two other groups that I would definitely give my stamp of approval to. For facial plastic surgery, you can consider a plastic surgeon who is certified by the American Board of Facial Plastic and Reconstructive Surgery. Now, these are ENTs, or otolaryngologists, that undergo specialized training in plastic surgery of the head and neck. What they don't undergo, however, is training of the breasts and the rest of the body. So if you're thinking about facial plastic surgery, rhinoplasty, facelift, neck lift, brow lift, then a facial plastic surgeon is a reasonable option. Unfortunately, I do know of facial plastic surgeons who are performing breast augmentation, tummy tucks, and liposuction, which are surgeries that they are not residency trained to perform, and I would really discourage you from seeing a facial plastic surgeon who is performing body surgeries. If you're thinking about eyelid surgery, then seeing a member of the American Society for Ophthalmic Plastic and Reconstructive Surgery, I think is reasonable. These are ophthalmologists that undergo specialized fellowship training in cosmetic surgery of the eyelids. So if you've got complicated eyelids, if you've got droopy eyelids, if issues with vision or complications from previous surgery, some of those patients I actually will send to a local member of the American Society for Ophthalmic Plastic and Reconstructive Surgery. We call them oculoplastic surgeons. Okay, so for the eyelids, that's an option. For the face, a facial plastic surgeon is an option. For the face, breast, and body, and everything else, though, a member of the American Society of Plastic Surgeons or American Society for Aesthetic Plastic Surgery is the way I would go. Well, what about other boards? As you can see, caution, don't do it. So there are many other boards out there. The boards that are most important are the ones that I just showed you. Now, it is an interesting fact that I can create my own board if I want. I can create my own Dr. Anthony Youn's board of the best cosmetic plastic surgeons in the world. And I could set this board up, and doctors could pay me to be a member of Dr. Anthony Youn's, board and say they're board certified. In reality, that board doesn't mean anything. And that's the case with other boards out there. They don't necessarily mean what the American Board of Plastic Surgery and the American Board of Facial Plastic and Reconstructive Surgery mean. You don't have necessarily the requirements to become certified by those boards. So once again, you can't go wrong with the American Board of Plastic Surgery if you're going to choose a plastic surgeon. Okay, be very wary of other boards that I do not mention here in this talk. Now, there are other ways that you can vet your surgeon. You can let the hospital do the work for you. So what I mean by that is hospitals, when you apply for privileges as a physician, they only let you do procedures that you are qualified to perform. So for example, I'm a member of a local hospital, and if I try to perform, let's say, a cardiac catheterization, they're not going to let me do it because I'm not fully trained to do that. If, on the other hand, let's say if a gynecologist wants to perform a breast augmentation at the hospital, they're not going to let them do that as well because they will be properly vetted, and they'll know that those doctors aren't properly trained to perform those types of procedures. So how do doctors get around it? Well, doctors get around it by performing these surgeries in their own offices. So although my hospital won't let me perform a cardiac catheterization at the hospital, if I wanted to do that in my office, there's no law against it. If I want to take out a gallbladder in my in-office operating room, there's no law against it, even though I'm not properly board certified and trained to do that. Okay, so that's how they get around it. So if you're unsure of whether your doctor is fully trained and properly vetted to do a procedure you're thinking about, then see which hospital that doctor works out of and find out if that doctor can perform the surgery at that hospital. The other thing you have to consider is if you develop a complication and that doctor is not properly trained to take care of that surgery or the complications of it, now you're going to have to find somebody else at that hospital who will take care of you. And that's a whole other problem that you may encounter. So really what bottom line is make sure you only choose a board certified plastic surgeon and one that has hospital privileges to perform the surgery that you're considering. Some other options is to check online doctor rating websites. There's one called realself.com you've probably heard of. This is a very popular website that has doctor ratings where as patients can actually go and rate their doctors as well as rate the procedures that they're thinking about. So if you go to that, you'll see doctors that have great ratings, some doctors not so good. Just keep in mind that there are ways to potentially spam websites like this. And so you may find that a great doctor has a couple of bad reviews. Well, are those reviews legit? Is that somebody who, has a bone to pick? Who knows? But just take a lot of these reviews with a grain of salt. Very important if you want to check your state's Board of Medicine website. If you see a doctor and you're kind of wondering, things don't seem right, by checking your state's Board of Medicine website, you can find out if that doctor has a license to practice medicine in your state, and you may even be able to find through the county courts whether that doctor has a lot of malpractice lawsuits. Now, in today's litigious climate, the vast majority of plastic surgeons have more than one lawsuit throughout their career. This is very common, and there's certain statistics that show plastic surgeons get sued literally every few years or something crazy like that. So if you have a plastic surgeon that you're considering and everything looks great, but that plastic surgeon has a couple of lawsuits, previous malpractice suits in the county courts, that may not be necessarily a bad thing. That's just something that in some ways is kind of the cost of doing business in medicine nowadays, unfortunately. However, if the doctor you're considering has lots of lawsuits, dozens of lawsuits, then you got to wonder if maybe that doctor may not perform the quality work that you may be thinking about having. So check your county courts to see your doctor's malpractice history. Another option is to ask nurses and other hospital employees. So nurses and hospital employees, they talk and they know who are the good surgeons and who are not so great. So by asking around at your local hospital, you should be able to find out information about the plastic surgeon that you are considering. And the final option is to talk to your family doctor. Some family doctors will really see a lot of before and afters of their patients, and they'll let you know what the patients tell them. Now, what should you expect during a consultation? Now, we do have a section on this pre-consultation, online pre-consultation, that will walk you through what I do, what I do during my consultation. But this is what you should expect in general from a consultation, whether you're going to come to see me or some other doctor. So the first thing is you want to meet your doctor during a consultation. If you don't meet your doctor during the consultation, that's a big red flag. That doctor obviously does not put enough importance in you as a patient to meet you during your consultation, and that is a big concern. You need to have all your questions answered during a consultation. A consultation is something that is a back and forth, okay? It is you giving your feelings, your desires, your beliefs to the doctor, and the two of you exchanging these ideas so that you can hopefully arrive at a good conclusion of whether plastic surgery may be a reasonable option for you. Okay, so you have to have those questions answered. If the doctor is too rushed and they don't answer your questions, then that is a red flag, and you got to consider that maybe that doctor isn't the right one for you. At the consultation also, the doctor should explain why the surgery that he or she recommends is right for you. Okay, there are some consultations where it is a sales. Okay, and you come in and they just want to sell you. You should have a facelift. You should have a nose job. You should have your eyelids done. You should have a breast augmentation. That is not a consultation. That is a sales visit. And what you need to expect in a consultation is the doctor to sit down and discuss with you whether the surgeries that you may be considering are right for you, whether they're good, the good and the bad about these operations, and how they apply specifically to you. Okay, so I hope this helps, especially if you're seeing somebody other than me in a face-to-face consultation. Well, what are some things to watch out for in a consultation? Well, if a doctor is too boastful, if a doctor toots his or her own horn too much, that should be a bit of a concern, okay? Yes, doctors and surgeons especially can be a bit arrogant. They can be a bit self-absorbed. I think in some ways to be a surgeon, you almost have to be a little bit like that to be able to operate on somebody and to do these types of surgeries. But if you meet a doctor and all they do is talk about how great they are, sometimes they may be hiding how maybe not so great they are. So you want to take that into account. The people who should toot a doctor's horn is not necessarily the doctor, but those doctors' patients and maybe the employees. If you go to a consultation and they have high-pressure sales tactics, that you also want to be concerned about. That may not be in your best interest to see that doctor. Really, a plastic surgeon should always be a physician first, looking out for your best interest first, and then the plastic surgeon second, or a business person after that. If your plastic surgeon says yes to everything that you ask for, that you want, that might be a red flag as well. There are some doctors that will do whatever you pay them to do, whether it's right for you or whether it's not, whether you're going to get a great result or won't. So you got to be careful if everything you ask for, they say yes to. If the doctor has a dirty office, well, pretty straightforward. This is surgery. Surgery needs to be clean. You want to avoid an infection, and if the doctor's dirty and the doctor's office is dirty, that's not a good sign. If the doctor tries to convince you to do something you don't want, that's also something to be concerned about. Now, realistically, sometimes patients have desires, and what they want isn't necessarily what's going to benefit them the most. That's a different story. But if you're coming in, let's say, wanting a nose job, and they talk to you about breast implants and trying to convince you to have breast implants, well, there's something wrong there. There are times, like I said, where I think it is reasonable. I've had patients that come in and they say they want a nose job, but the issue is not so much that they have a big nose, but they have a small chin, and the small chin makes their nose look bigger. So for them, actually doing a chin implant may benefit them more than making their nose smaller. So So keep that in mind, that if a doctor is trying to convince you to do something you don't want, really think about it. Is it in your best interest, or is it in the doctor's best interest to make money off of you? If it sounds too good to be true, it probably is. I know of doctors who tell patients that, oh, we'll put implants in you and they will lift your breast. Does that make sense? Implants don't lift breasts. It does not. So if it sounds too good to be true, it probably is. Their doctors say, oh, I've got this machine and it just will hover right over you and all your fat will be gone and your skin's going to be tightened up. No, it doesn't work that way. If it sounds too good to be true, it probably is. And the final thing is, if the doctor has unhappy employees, that's also a bad sign. Okay, the employees should be there to take care of you. If they're unhappy, you got to wonder why. Some other things to watch out for: the bigger the ad, the worse the plastic surgeon. Now, in my area, like many of yours, we have our local glossy magazines that have the fancy ads in it from many different surgeons. Well, if your doctor has an ad in it and it's huge and it's every week, that costs a lot of money. Does that doctor really need those ads to bring in new patients, or does that doctor have good word of mouth and ideally doesn't need the ads at all? So that's something you want to consider. Some of the doctors that I see just in my area that have the biggest ads have the worst reputations, and they buy ads because nobody else would go see them if they didn't see their name in an ad. Watch out for phony plastic surgeons. There are OBGYNs, there are ER doctors, there are ophthalmologists who are performing plastic surgeries that they shouldn't. I know of ophthalmologists performing breast implants, ER docs performing tummy tucks, GYNs performing facelifts. So this is something you really have to be wary of. Once again, I said earlier, any doctor can perform any procedure in their office legally as long as you sign on the dotted line. So do your homework and make sure that you're not taken by one of these phony plastic surgeons. There are also practices that are considered high volume, low quality practices. And what I mean by that is there are a lot of doctors out there who are performing 8 to 10, let's say, breast augmentations in one day. Each one may take a half hour. That's not a good thing, okay? And so they kind of, it's like the fast food type of plastic surgery where quality is poor, but they get a lot of them out there to try to make a lot of money, and that's not necessarily good for you. And doctors that are too fast or too slow are a concern, okay? Ideally, you want a doctor that is efficient, okay, because you don't want to be under anesthesia longer than you need to be. But once again, if a doctor says, oh, I'll do your breast augmentation in 20 minutes, that's a concern. Is that doctor going to actually be sitting you up? Is that doctor going to make sure that everything looks nice and even? Or is that doctor just trying to get through your surgery to the next patient? Okay, so be careful. On the flip side, doctors that are too slow, being under anesthesia for too long isn't something that's good for you. You're getting chemicals in your body that you don't necessarily need, so you don't want somebody who's kind of that slow snail type of surgeon that takes forever, because you may actually develop a higher risk of complications from that. So remember, the most important thing is you got to do your homework. It is the wild west of medicine. That's what plastic surgery is nowadays, because there are so many doctors out there and even non-doctors who are performing procedures that they are not properly trained to do. If the first thing you just got to keep in mind is find yourself a board-certified plastic surgeon. If you're considering cosmetic surgery, a member of ASAPS. So I hope that this has been helpful for you on how to choose a plastic surgeon for yourself. If that plastic surgeon ends up being me, well, it's an honor and it would be a privilege to take care of you, and I thank you for considering me. If you decide to go a different direction, or if you want to see somebody else, please pay attention to the recommendations I make here, because you want to make sure that you don't end up being a patient who afterwards says, darn it, I wish I would have done my homework. Thank you for watching.